Life Unrehearsed, brought to you by Leanna Senior Transition Support, specialists in downsizing and seniors residences.
Good afternoon. Welcome to Life Unrehearsed. My name is Matt Delvecchio, specializing in life transitions, downsizing in the senior living industry.
And I'm Corey Sirota, clinical social worker and psychotherapist specializing in grief and loss.
Coming right up on the first half of today's show, would you know what to do if you or someone you know was having a stroke? Thankfully, we have neurologist Dr. Ted Wein on the show to shed some information that could literally save your life. Now, Corey, there's probably a lot of loyal CJD listeners that might be saying, wait a minute, it's not Sunday. Well, right. For the regular listeners, normally Life Unrehearsed would be on Sundays at 4 o'clock. And we've just been switched effective this week to Saturday at 3 p.m. to 4 p.m. And Corey, we're quite excited about this, aren't we?
That's right. Surprise, everybody, surprise. It may be a new time and a new day, but it's the same great show.
Absolutely. And what I didn't know or realize, but in the radio world, there's actually a few more listeners on Saturdays than there are Sundays, as I've come to find out. So just bonus. And so we're really looking forward to the loyal listeners and maybe perhaps some new listeners here on Saturday at 3 o'clock on Life Unrehearsed.
Hi, nice to meet you all. On a different note, and a more somber note, I did want to mention and send condolences to the Bronstein family, because we had a dynamite guest, Sharon Bronstein, who came on the show, and she's an incredible, lovely lady, and unfortunately she died quite suddenly last week. So condolences go out to the family and friends of Sharon Bronstein.
Oh, yes, absolutely. We had Sharon as a guest, and so dynamic and so radiant, and so many people loving her Sharon B. Bronzer, including Stephanie, my wife, who's a raving fan. So absolutely condolences to the Bronstein family. What do we have coming up on the second half, Corey?
On the second half, you're going to meet a guy who lost over 100 pounds 10 years ago. But not only did he keep it off, he also created a protein bar as part of his effort, not only to help himself, but to help others live a healthier lifestyle. That's coming up after the 4:30 news. Yeah, 3:30 news.
That's right. We got to get used to this.
Yeah, that's right.
The new time. All right. You know, every year in Canada, there are over 50,000 new strokes. That's one stroke every 10 minutes. And stroke is the leading cause of adult disability in Canada and the third leading cause of death. But, you know, we can all be proactive when it comes to stroke prevention, and we can also avoid serious damage by acting quickly if a stroke were to occur. And so to help guide us and to provide us with some greater insight, we're very pleased to have Dr. Ted Wein on the line. Dr. Wein is a neurologist from McGill University, where he works at St. Mary's Hospital, as well as the Stroke Prevention Clinic at the Montreal General Hospital. Dr. Wein, always great to have you on Life Unrehearsed. Welcome back.
Thank you so much. A pleasure to be here.
All right, we're going to get right into it. What can we do right now to prevent strokes, or at least minimize the risk of stroke?
So that's a great question, and I want to point out to our audience that there are a lot of things that we can do to help minimize our risk of stroke. While you just mentioned that we have 50,000 strokes a year in Canada, I'm actually going to give you some updated figures that you may not like, but the number is actually up to 62,000 a year in Canada. And as Canada's population gets older, our risk of stroke is getting older, as age is one of the biggest predictors of stroke. But obviously, we can't change that. But there's two studies I want to share with you. One of them is a wonderful study done in the United States, where it showed that if you just quit smoking, if you exercise 30 minutes a day of what we call moderate vigorous activity. So that means that you're not really able to talk so easily when you're exercising. And you do that for 30 minutes a day. If you keep a proper diet as defined by the Canada Health Guide or the Mediterranean diet or any of these nationally approved diets, as well as diminish your alcohol consumption. Women shouldn't have more than 1 drink per day and men for 2 drinks per day. And if we keep our waistline down, just doing those 5 things together, in this U.S. study of over 1 million people, was shown that those individuals who were able to do all 5 of those things reduced their risk of having a stroke by 80%. And women did better than men. Women reduced it by 80%, men did by 70%. So just that basic lifestyle is the first thing you can do. The second aspect is if you have diabetes, if you have high blood pressure, controlling those 2 risk factors are one of the major things you can do in order to reduce your risk of subsequently having a stroke.
So, of course, women did better. This does not come as any surprise to me. Is anybody out there surprised? Okay. That aside, there's a term that I hear a lot, and I don't really understand it, and I think it's very relevant to our discussion. What is cardiovascular health?
So that's a great question, Corey. And cardiovascular health really refers to the entire heart and vascular system. So when we talk about cardiovascular health, it refers to making sure that the heart is healthy. The heart is a pump that's going to pump blood to the various organs. It brings nutrients and oxygen to these organs. So we need to make sure that that heart muscle is working fine. So part of the term is we're referring to that healthy heart. The other term is vascular, and that's referring to the blood vessels. So the blood vessels are the pipes that are carrying the blood that the heart is pumping to bring energy, to bring nutrition, and to get rid of toxic waste from the different organs in order to make sure everything is healthy. So by keeping your heart pumping well and keeping your blood vessels clean and not clogged with fat, that is what's going to maximize your cardiovascular system from working optimally, getting oxygen where it needs to go, making sure the various organs, particularly the brain, are getting all the oxygen and nutrients they need. And diseases that are affected by cardiovascular health include strokes, where you have blocked arteries in the brain, coronary artery disease, where the arteries to the heart get blocked, heart failure, where the heart isn't pumping properly, so blood's going to accumulate and the fluid is going to back up into your lungs. And another aspect that's really neglected is what we call peripheral vascular disease. And this is where the blood vessels in your legs are starting to get clogged with fat or atherosclerosis, so the blood doesn't flow very well there. And when you start to walk, you'll get this tightness or cramping because the muscles just aren't getting enough oxygen.
We're talking with neurologist Dr. Ted Wein here on Life Unrehearsed. And Dr. Wein, we talked about gender. Now, is there one gender that is more at risk than the others? I've seen both sides, that men are more at risk, women are more at risk. What's the latest data?
So the latest data for the world is that women are more affected than men by around 5 to 10%. However, if you look at the newest stroke statistics in Canada, there's around 62,000 strokes a year. Of around 31,000 of them are women. So right now in Canada, we're sort of at a 50-50 split for the risk of stroke. So it's very variable, but the age groups and the time that we see the strokes are distinctly different between the two populations. Women, in fact, tend to have strokes at older ages, but they also are at risk during pregnancy of that happening to them. And it's a little bit concerning because women with stroke in Canada tend to have a worse outcome. Around 1/3 of them will die within the first year, unfortunately. They're much less likely after a stroke to go home. They're much less likely to go to rehabilitation. And they seem to have a much poorer outcome than men when they have strokes.
So I want to ask you something. What I understand about treating strokes, the speed is crucial. Is this true, false, and what does that even mean?
So absolutely. We use the acronym that time is brain. So a stroke, again, is a blocked artery in the brain. And for every minute that your brain doesn't get oxygen, you're going to lose around 2 million brain cells per minute, around 14 billion connections between the brain cells, and we're going to lose around 12 kilometers of axons, which are the larger nerves connecting everything together. So there are treatments out there for stroke. There are medications that help break up the blood clot that causes stroke, and that can be given within the first 4.5 hours, and in some people after 4.5 hours. And then we have a newer therapy, which can be provided only at certain centers, where we actually put a catheter. So a catheter goes into your groin, and we actually go up into the brain, into the artery, and suck out or mechanically disrupt the clot. But again, this needs to be done within the first 6 hours. And that's why the Heart and Stroke Foundation has been very proactive in encouraging people to use, I don't know if you've heard this, but you've heard it on the radio, called FAST, that if you have drooping of your face for F, if you have trouble speaking, that those are all things that we are related to time. And timing is crucial. If you have any signs or symptoms of stroke, call 911. When I was doing my research in the U.S., however, we went to look at who actually called 911, and it was only 3% of stroke patients that actually realized they were having a stroke. And it's really important for family members to be aware of the signs and symptoms of stroke in order to call 911 and get people to the hospital as soon as possible so we have therapies to offer them.
And we're going to come right back with neurologist Dr. Ted Wein. Dr. Wein, there's always been some talk about, we think of strokes mainly with the elderly and seniors, and that's far from the truth. So we're going to hear about the age and how strokes are related to age when we come back.
Life Unrehearsed, brought to you by Leanna Senior Transition Support, specialists in downsizing and seniors residences.
Welcome back to Life Unrehearsed. I'm Cori Sirota, along with my co-host Matt Delvecchio, and we are talking to Dr. Ted Wein, prominent Montreal neurologist, who is teaching us about stroke prevention and what to do, in fact, in case of a stroke. One of the things we were talking about before we went out to traffic is the age of people having strokes. I think we always believe that, or think about it, I know I do, as elderly. But has that changed, Dr. Wein?
Yeah, so unfortunately it has changed, and part of the change has to do with several issues. One is more research focused on the area and better technologies at being able to diagnose the stroke. So I'm going to start off with kids. And when I talk about kids, I'm talking about kids that are still in their mother's wombs till that first month of life. And this may surprise you, but there's actually 10,000 children less than age 18 who are living with stroke in Canada. And in fact, if we look at neonates, predominantly those that are born premature, there's probably a bleeding stroke in the brain for every 6,300 live births. So that's pretty high there. And if we look at kids that are premature, the stroke rate is 1 in 1,500. And that's what's really led to some concern. We haven't identified the cause of all of the strokes in this age group, but around 20% of them are due to underlying heart problems. But I think it's really important for the most part to reassure parents that they're not doing anything wrong either, and they're not the cause of the stroke. But there's a big population for Canada. To mean 10,000 kids is really, really challenging. And part of the challenge to confirm the diagnosis, when you have a newborn, it's kind of hard to see if they're not speaking, because they don't speak at that age. You know, they're not walking, so you can't really appreciate some of the finer things we look for on our neurological exam in order to confirm the diagnosis. But now with the availability of MRI and better ultrasound and CT scans, we're able to confirm the diagnosis.
As neurologist Dr. Wein, and one of the things you were talking earlier on, Dr. Wein, was about looking for those signs of someone having a stroke. You talked about the old acronym FAST, with the face drooping and the arm weakness and speech difficulty. The T part of that is it's time to call 911. However, if you're seeing someone exhibiting these signs, aside from calling 911, this is frightening for people when you're seeing this. What can someone do in that situation?
Right. Well, I think the first thing to do is stay calm. Number two is to directly go and call 911. If someone is fallen to the side or has saliva in their mouth, is really to make sure their airway is clear, put them on their side, making sure saliva or whatever is draining properly. But unfortunately, there's not much else you can do in the community for this. For us as physicians, the first thing we need to do is identify whether this was a stroke, which is a blocked artery in the brain, or if this was a stroke that was a bleed in the brain. And as you're aware, one of the things we do for stroke patients is we give them aspirin or different antiplatelet agents or blood thinners. But we really can't make that decision until we get the CT scan done to see what type of stroke they've had. Things that you can do that will really help us at the hospital, however, is what time did the stroke start at? We have a very tight time window to give the therapies we have, and knowing exactly what time it happened at is essential. Number two is what medications is the patient on? The individual getting that medication list sometimes doesn't allow us to provide certain therapies acutely, and getting that information with them. And finally, what their past medical history is. We're giving medications that break up blood clots, they can cause bleeding, and we really need to know what past medical history they've had, and if there's any other bleeding in other parts of the body that may preclude them from getting this therapy. And probably those three things, if we have that instantaneously at the door when they come in really helps us a lot in giving medications or therapies ASAP.
I so appreciate what you're saying, because that really helps people feel a lot less helpless given the situation. And so if they know that it's probably good practice to have medications listed and a note time, and so you know that, so you have it, so you're not waiting around for something to happen, but if it happens, you know that these are things you can do. You mentioned something that you mentioned 2 types of strokes. So I was not really all that familiar or aware. I imagine that is there other types of strokes? What are the different types of strokes?
Right. So that's a great question, and I hope I'm not going to confuse the audience. But we basically have what we call ischemic stroke. So that means the artery is blocked, and that can be either due to a blockage of the artery in the brain due to fat that's lodged there. Sometimes our main artery going to the brain, called the carotid artery, which is one of the largest arteries after the aorta, can have a piece of fat that can go fly off. Sometimes you can have something from your aorta, a piece of fat or a blood clot fly off, and that would get occluded. And those were the ischemic strokes. We then have what's called hemorrhagic strokes. These are strokes where the artery actually ruptures. And we see this predominantly with people with high blood pressure. And sometimes we see it with people who have an abnormal collection of blood vessels, where an artery, you were born this way, and the artery is connected to the vein, and it will rupture and you'll bleed into the brain. And then the third type of stroke is from an aneurysm. So this would also be a bleed in the brain, but where a little aneurysm forms. So an aneurysm is like a little balloon or bubble that forms on the artery, and that will rupture. The last type of stroke, which is much rarer, is what we call a venous stroke. So this is not a blood clot in the artery, and it's not a ruptured blood vessel, but it's actually the vein in the brain gets blocked. And this causes the blood to back up, not be able to drain, and you get a stroke that's both ischemic, because the artery is blocked, but you tend to bleed with that as well.
Again, Dr. Ted Wein, a prominent neurologist, and it's so valuable, the information you're providing us here with Corey and Matt on Life Unrehearsed. We have about a minute left, Dr. Wein. Real quick, because we understand that therapy and treatments post-stroke are improving. Can you give some of the latest on that?
Yeah, so we have lots of, like I've said, we've had new treatments for the acute stroke as soon as you get to the hospital. We're making advancements in rehabilitation. We're finding out new combinations of medications that are more effective of preventing you from getting a second stroke. We're now putting on people on 2 blood thinners for the first 21 days for most people with minor stroke or TIAs, those transient stroke symptoms, and recognizing them is crucial. We've learned more about where we want to target blood pressure, where we want to get cholesterol down. In our new guidelines coming out next month, we're even going to be treating not only the LDL cholesterol or the bad cholesterol, but we're going to recommend to treat the triglycerides as well. And I think other aspects of stroke care are dealing with the complications of stroke for not only the patient, but the family. Treating depression, helping family dynamics, being supportive, recognizing that memory loss goes along with stroke now, and being aware of all these things are all imperative to be identified so that we not only improve the patient's quality of life, but the family and the caregiver's quality of life. I'll just make one quick last statement that families sacrifice so much of their time to take care of family members with stroke. And last year, we had a study that showed that Canadians lose around $25 billion of unearned income staying home to take care of their family member with a stroke.
Wow. Well, it's encouraging. We're seeing some real nice progress. And Dr. Ted Wein, thank you once again for coming on Life Unrehearsed and providing some valuable advice.
All right. Thank you so much, guys.
All right. Corey, what do we have coming up next?
Coming up on Life Unrehearsed, Ryan Schwartz lost over 100 pounds about 10 years ago. Not only has he kept it off, but he's also created protein bars as part of his effort to help others live a healthier lifestyle. That's coming up.